Thank you, Mr. Chairman. One of the problems we have in this discussion is a lot of the problems are articulated and then solutions are offered, and very little effort is made to see how the solutions actually solve the problems. Mrs. Hovind, did I understand your testimony that physicians are routinely charging for services that are not medically necessary to the tune of 70 to $126 billion?
I'm talking about defensive medicine.
I ask you, are those services that are not medically necessary?
They are services that are medically indicated and medically necessary if you look at guidelines and criteria. However, what does not happen is my clinical judgment whether to employ that test is disregarded.
Are you suggesting that the services are not medically necessary? If liability were not a factor, would the services be provided or not?
It depends on the case. It depends on the situation. It depends on the environment of care.
And you're suggesting that in 70 to $126 billion worth of cases, services were rendered that were not medically necessary, were not needed.
That's not what I said, Congressman.
Well, what are you saying?
I am saying that health care delivered in the examining room, in the operating room, is driven by what is based on clinical judgment and based on assurance testing, which is documentation and proving that, in fact, that is what is wrong with the patient. When we talk about cost control in this country, we're talking about the fact that, and this goes to the whole issue of cost containment, which is if, in fact, you would recognize my medical judgment and allow me to decide when it is important to do a test or not, then our patients would be better served.
By not providing the services?
If, in my judgment, they don't need it.
And you're not able to, and you charge for services that, in your judgment, are not needed to the tune of 70 to $126 billion?
I do not do that. However,
I mean, your testimony was that physicians are charging 70 to $126 billion more than necessary, and then blame it on liability. Now, is that your testimony?
Yes, that is my testimony.
That it is not necessary, that you're providing services that are not necessary. Either they're necessary or they're not.
We're practicing in a culture of fear, and that culture of fear lends itself to protecting oneself. I have been sued, Congressman. Let me tell you.
Wait a minute. I just had to ask you a simple question. You gave 70 to $126 billion. I just want to know what that represents.
That is costs for tests and procedures, which, if you look at guidelines, would be medically necessary, but my medical judgment is discounted.
That based on your medical judgment should not have been provided?
Not necessarily.
Okay, well, I'm not getting... Ms. Doroshow, if physicians are charging for services that are not necessary, how is that different from medical fraud?
Well, that's a good question, because in order to get reimbursed, to file a claim with Medicare and to be reimbursed, physicians have to file a form and certify that the test and procedure, the services that they provided are medically necessary for the health of the patient. So it does raise a question whether or not some claims may be false if physicians are not.
Ms. Doroshow, I was looking at this Institute of Medicine study, and you cited it in your opening statements and in your packet. And it says that as many as 98,000 patients die annually due to medical errors. Wow. And what we found was it has shown to be exaggerated and unreliable. Isn't that true? Because based on shortly after its release in 2000, the study came under heavy criticism for imprecise methodology that greatly overstated the rate of deaths from medical errors. For example, the study data treated deaths from drug abuse as medication errors. And Dr. Troy M. Brennan, the lead Harvard researcher who compiled much of the data upon the report, which was based, later revisited his methodology and determined that the actual figure could be as little as 10% of the OIM's estimate. Is that true?
Well, what's true is that many other studies since then have found far more than 98,000 deaths. Health grades many other institutions that have looked into it. And just in November, HHS took a look at this issue again, and they found that 1 in 7 patients in hospitals are victims of an adverse event, and 44% of them are preventable. Also, there was a study just also released in November of North Carolina hospitals. North Carolina is supposed to be a leader in patient safety, basically finding that since the Institute of Medicine report, patient safety has not improved at all, and it really kind of shocked the authors of this research study, and they found that the errors that are causing deaths and injuries are continuing at an epidemic rate. So I would say that the 98,000 figure at this point is low and has been probably upped by every patient and government study that has looked into it since.
So your testimony is that every adverse event is a medical malpractice
I'm
issue?
looking at the studies and how they define it. In, for example, the HHS study, they found 1 in 7 Medicare patients are the victim of an adverse event, and 44% are preventable. So,
again, are you saying that
preventable errors are
is an adverse, in your eyes, is an adverse event medical malpractice?
A preventable adverse event is.
The other thing I wanted to know is I know who Dr. Hoven is representing, and I know who Dr. Weinstein is representing, but I couldn't find in your documentation where the Center for Democracy and Justice gets its funding. Could you provide the committee with a list of your fellow and associate members so we have an accurate understanding of the point of view in which you are presenting? And also, you mentioned the demo projects and that they're going to get grant funding. Are you or anybody that is associated with the Center for Justice and Democracy able to apply for those grants?
Apply for which grants?
The ones for the research that you were speaking about earlier?
Well, we're tiny. We have about 5 people on our staff. We are not a high-budget operation. So we don't really have the staff to do research projects like that. We hope other people would do that.
Again, I would like to know, like your fellow and associate members, are they going to be applying for those grants?
Our associate members, I would have no information about any of that. I don't know. Those grants were already, that process has already taken place. HHS has already granted the money. In New York, for example, it granted $3 million to the Office of Court Administration in conjunction with the Department of Health that is looking at a specific proposal that was presented to them. So actually, I know a lot about that proposal. I know about a few of the others, but that has already happened.
Are you aware, and this goes to all 3 of you, and I think Dr. Weinstein and Dr. Hoven have said this, and I just want to make sure that you are aware also, that there are certain professions in the medical field that have stopped practicing because they can't see enough patients in order to cover their insurance costs. Just the cost alone. Not because they've done anything wrong, but they cannot see enough patients to cover their malpractice insurance cost.
Well, I hope that also you're aware that since 2006, we have been in a soft insurance market. That's why you don't hear any longer about doctors picketing on state legislatures and capitals and trauma centers, et cetera, that we did in the early part of the 2000s when we were in a hard insurance market, when rates were going up 100, 200% for doctors. This is a cyclical industry. This has happened 3 times in the last 30 years when rates have shot up like this. To believe that the legal system has anything to do with it, you would have to believe that juries engineered large awards in 1975 and then stopped for 10 years and then did it again in 1986 to 1988 and then stopped for 17 years and then started up again in 2001. Of course, that's never been true. The claims have always been steady and stable. So what's driving insurance rate hikes is the insurance and accounting practices of the insurance industry. The solutions to that problem lie with the insurance industry. They should not be solved on the backs of injured patients.
I see my time has expired. I look forward to further discussion.
Thank you, Ms. Adams.